And I'm pleased to be your teacher for this course. I've recognized some of your names and I'm glad to be working with you once again. I know you're a very hardworking group. So, I know when we see that we have to take a health policy course, we kind of think, well, why do I need to know this? So hopefully that becomes very clear to you very shortly. So I'm just going to minimize my face so that you can see some of the slides. This is just an introductory lecture to get you thinking in the right direction. So today we'll orient to the course, to the professor, and certainly throughout the week you'll orient to your fellow classmates in the discussion board. I know some of you like to Skype as well or Zoom. We've tried that before as a group. So that's something that you can do to discuss some of your assignments. So don't forget about that. You can even call each other on the telephone. You can text. There's so many ways to stay connected. We'll be describing the role of the advanced practice nurse. And in your text, I think it says advanced practice registered nurse to legislators, consumers, and other professionals who aren't nurses, non-nurse professionals. We'll distinguish the difference between agency policy and health policy. And I bring that up because that seems to be a huge leap that many students and nurses need to take as they start thinking about health, public health policy, which can affect the whole world. It's not just an agency policy. So we'll be describing what is meant by health policy to try to point your nose in the right direction. As I said, I'm Dr. Kate Stiller. I've been teaching for 26 years. I have taught at Edinburgh University. I taught this course in 2011, 2012, but I'm currently updating it now because that's 4 years ago. So I've taught at Edinburgh University, Gannon, St. Vincent's School of Nursing, Mercyhurst University, the University of Akron, Ohio. I got my undergraduate and master's degree at Edinburgh University. And you're so lucky you can do it online because I had to drive an hour and a half to and from and then work night shifts. So I know what it's like to be a graduate student. It isn't easy. I worked on a PhD through Case Western Reserve University in Cleveland, Ohio, and I had to travel 2 hours to get there. And I worked on my degree over a span of 10 years while creating a little family, much like many of you are right now. I was actually pregnant as I went through school as well. So it's challenging, but very doable. My area of expertise is adult medical surgical nursing. Some of you may have worked with me out on the floor recently. Only 2 years ago, I was working oncology at Hammett and oncology at St. Vincent's, and also through Fast Track at St. Vincent Health Center. In the late 90s, I was charged with developing a hospital-based complementary or alternative health care center. Now we call it integrative care because the belief is that these therapies that are thought of as being alternative should be integrated with standard care. So I know an awful lot about complementary and alternative therapies, holistic care, palliative care, hospice care, those sorts of things, because I'm very interested in trying to allay suffering for our patients. So you all develop your primary interest too as you develop further as nurse scholars, and some of you may have already dedicated a good deal of your life pushing an issue forward. So the name of this course is 645 Nursing and Public Policy. We'll be talking about how policy impacts advanced practice registered nurses, but that's really just a brief part of the course. What I'd like to do is encourage you to be politically active, to move forward on major issues that affect the health of people, not necessarily just the patients that you take care of, but all people here in our city, here in the United States, and in the world. So nurses are in a unique position to understand health fully, to understand how our patients are being impacted by the current healthcare system and regulations that are already in place or not in place. Maybe in some cases we need policy changes, such as banning smoking in public places. That was something that really is probably going to have some positive health effects on people, especially people who have to work in bars and restaurants, just as an example. So we as nurse leaders are in a unique position to safeguard the health of the public. And so in introducing yourselves to the course, of course, much of this is done independently. You need to, as always, and I know you all know how to do this, look over your syllabus, see what kinds of assignments you have. There are some general guidelines for each assignment. In the syllabus, it explains the course. There's a description. There's overall outcomes for what we hope to achieve by the time you leave this course. And I tend to pick away, as you look at the topical outline, I'll try to integrate those topics in with our weekly learning and try to, separate it out in chunks that are manageable. But you do have a number of assignments. If you look at your assignments, you have an elevator speech, a policy and action assignment, a little quiz that's worth very little, that just tests your current knowledge in health policy and how our government works, a legislative briefing book, a grant proposal presentation, which is a PowerPoint presentation online, or some other I can't think of the name of the other one. I'm thinking Stevia. That's not it. Prezi, something like that. If you want to use some other format, that's fine too, just so that you're able to present your key points. So, and then you get quite a bit of points for discussion board presentation and discussion as well. This is a time for you to show what you've learned throughout the week. It's not just saying how you feel, but discussion board involves a scholarly discussion, which means you'll have references for each of your posts, and you'll reference your readings, or some of you probably have gotten curious and found some outside sites and citations that you can include as well, and kind of tune the class into some alternate sites that concern themselves with health policy or some aspect of health policy. So there is a rubric for the discussion board and guidelines for discussion, but I'm not as concerned about typos or sentence structure in the discussion board, but I do want you to apply theory that we're learning about and for it to be a scholarly discussion. So your syllabus gives you a lot of what you need to know in terms of what constitutes your grade in the course. And then you have your course outline. And it has, of course, our week starts at Tuesday in the morning and ends Monday night at 11:59 p.m. So things are usually due at the end of the week, in most cases, at 11:59 on Monday. So as you look through the syllabus, you'll see you have readings in your Milstead text, which I have posted in our course, and you may have some outside readings or YouTube videos to watch that week. Please make sure that you do these things. If you don't, you're not going to learn anything in the course whatsoever. And also your discussion boards will reflect a lack of understanding of the content. You won't get as good of a grade as you could if you have an informed discussion board post. So that's our syllabus, our course calendar. I've tried to include some guidelines for your assignments as well, so you know what's expected of you. And this week, you're going to meet your classmates by introducing yourself on the board. And please make comment to at least 2 other classmates' posts in their introduction. And this is one time where you don't have to include a reference. And this isn't graded. This is just a time for us all to meld together. So, the advanced practice registered nurse certainly does have relationships with legislators, and our consumers are our clients, our patients. I know some of you are administrators, and some of you may be case managers, and you're fulfilling all kinds of roles, but you always have a certain group of people that you're serving or working with so that they are your consumers. And there's more and more information in the literature on communicating with non-nurse health professionals. And they want to transform education and practice so that it's more interdisciplinary, because the general belief is that will enhance communication and therefore will enhance care. So you'll notice in your text there's a lot of information about communicating interprofessionally, between doctors, nurses, therapists, etc., and also including the patient in the decision making in what we do. So I'm telling you, you're going to see more and more about that in the future. So we will be discussing legislation that affects advanced practice registered nurses and also regulations. And it's very complicated. It varies tremendously from state to state. I know you've talked about this in some of your other courses. So we'll discuss that from a health policy perspective. You need to be in tune to what kinds of regulations and legislation is coming down the pike that will affect you as a professional. So that's why it's good to join an organization like the American Association of Nurse Practitioners, even as a student. And I hope most of you have already joined that, because you get a tremendous amount of information from them that is helpful to you. So there are other health policies, not necessarily that are written just for nurses, but other health policies that impact you tremendously. We're all aware of the Affordable Care Act, which people affectionately call Obamacare, and how that we were planning on more people being able to get health care, and there'd be a greater need than ever for nurse practitioners as primary care providers, social workers, therapists, etc., because we're going to have more people in the system who need our kind of help. So the point is, we don't all want to be politically active, but we really need to start thinking about being more politically active and more aware, not just of our day-to-day jobs, but what's going on in the world. And now that we have a new president as well, things might change. So it might be more important than ever to be aware of what's going on. Okay, so students get confused about agency policy versus health policy. Agency policy are those policies that help the organization run smoothly and provide excellent care to patients. So these are things, you might have quality indicators that you measure, or you're involved with trying to reduce CAUTIs or CLABSIs or falls, and that's all agency work. That's not public health policy. What do we mean by health policy? Health policy refers to, this is a long definition, but let's think about it as I read it. Decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. An explicit health policy can achieve several things. It defines a vision for the future, which in turn helps to establish targets and points of reference for the short and medium term. It outlines priorities and the expected roles of different groups, and it builds consensus and informs people. And this is from a site, the World Health Organization site. So, once more, who cares? Who cares? Well, if we don't care about health policy, who will? You know, legislators depend on us, and they even have some go-to people that they go to who are nurses who inform them. I included this nurse with this elder because in taking care of my elderly parents over these last couple years, I realized that the plight of the elderly in our society is very sad. There's very little resources available to them. I mean, there's resources, but it's just not enough because they lose everything that they have: mobility, their health, their loved ones, and many elderly people might be all alone. So, to me, I think nurses need to advocate for elders' concerns. And one of those concerns might be, for example, and it's an ethically charged issue, is providing comfort care earlier on so that if they don't want to live anymore, that they have that choice to let go. And I'm sure most of you have seen many elders who are ready to go, and yes, yet we're, kind of forcing them to continue onward and upward even though they don't want to. So that would be an example of a health policy issue that really needs some work. And I think President Obama tried to work with that early in his tenure. You might remember people remarking about the death panels. So that was dropped very quickly after all those insinuations were flying around how, we want to just kill our elderly so that we don't have to take care of them anymore. But that's really not the case. The case is we need to think about whether we're really just, creating more suffering for our elders. So this is just one example of why we should care. If we don't care, who will? So policy is presented as a process in your textbook, and it's kind of like the nursing process. You start out with a plan or agenda setting. What is your agenda? It's important to remember that. What's your goal? What do you hope to achieve? What kind of legislation is already in place? What kind of legislation do you want to see change specifically? If you go visit a health policy leader, a mayor, a governor, a representative, you go see them. You have to tell them what you'd like to see changed. And they don't have time to do all the research. So what kind of legislation is already in place and what changes would you like to see? Why? Is there any evidence that those changes have shown some positive outcome somewhere else or on a smaller scale? And then eventually regulations come about. So in a couple, next week we'll be talking about agenda setting. The week after we'll be talking about legislation. Week 3 we'll be talking about regulation, implementation of policy changes, and finally, how do we evaluate whether they're working or having any positive effect or not? So that's some of what we're going to do in this course is talk about policy as a process. And I bet many of you have been politically active, so I hope that you will share your stories. And usually when we are active, it's something that relates to our clinical practice. But being involved with policy changes are more large than just our clinical issues. So in order to be a mover and shaker in the area of policy making, you have to have knowledge of change. Now, how is change most easily brought about? Most of us have been exposed to change theory, but we will talk a little bit more about that again. We may have to have some skills in conflict resolution. and be assertive. We can't someone just shoots us down and we say, oh, yeah, I guess what I have isn't a very good idea after all. That wouldn't be very assertive. So I was just thinking when I was promoting complementary care, I was actually meeting up with insurance leaders and try to convince them to provide funding for acupuncture for their patients. And I presented evidence that showed that acupuncture was more cost effective and very effective in terms of relieving pain in individuals. And I was asking them why they weren't exploring this, and they weren't open at all whatsoever to my presentation. So that's a situation where you just have to keep moving forward. You know, you could visit legislators as well and ask them to push forward for insurers to pay for complementary and alternative therapies, for example. So you have to have a lot of perseverance and assertiveness and a lot of grit. And you do have to be a skillful communicator, and you have to be able to negotiate at times, and also to use the group process effectively. If you're speaking in a group, you want to do it in the most effective manner. And these are all skills we'll be talking about in this course as well, and it may help you in other spheres of your life. So, just to give you an idea of how health policy or public health policy is different from organizational policy, I thought we could look at some examples. This board table kind of looks like what I had to go visit the State Board of Nursing. I was the director of associate degree program of nursing, and we weren't reaching our 80% pass rates on the National Council licensure exam. If you don't reach an 80% pass rate, we have the State Board of Nursing, which will close your school down if you don't go and explain to them what your plan is for increasing your pass rate. And there's a board, and it has 12 members, which is a little less than, this looks just like if you ever have to go to Harrisburg and sit in front of the State Board of Nursing, it looks just like this. So that's an example of a nurse working toward making some change, or working in a small way toward keeping a school open so that people can get their 2-year degree and eventually come back to school and get their nurse practitioner degrees, so that you have enough nurses in the state of Pennsylvania to take care of patients who need us. But anyhow, some examples of health policy issues are having safe nurse-to-patient ratios. I contacted a representative many years ago because, I was left on the floor with one travel nurse and just me on a whole oncology unit. And there were no aides and no secretary, just a traveling nurse and a per diem nurse. So that was very unsafe. And it motivated me to contact my representative. Now, all I got back was a letter from an assistant to the representative telling me that we already have rules in place. Well, the rules aren't working. Okay, so that's when you have to persevere, and you have to look at, what controls nurse to patient ratios? Are there any mandates? Are there any regulations? How clear are these regulations? Are they wide open? Do they just say something like you have to have enough nurses to make sure that safe care is given? When things are left wide open like that, then you can have just about anything. So that's an example of a health policy issue. I have a lot of graduate students who, when they pick projects, they choose to work with that. The other huge problem, there I go, making puns unintentionally. Childhood obesity. Look at this cute little button up here, but look how obese that little baby is. lots of times children are really big when they're small and they lose their baby fat, but we're not seeing that anymore. We're seeing a rise in childhood obesity. It continues into their older childhood years and into their adulthood, and they develop diabetes and a whole host of other health problems. So that's a really important issue that lots of students choose to work with. It's not enough to say I want to work to support decreasing childhood obesity. You have to come up with a plan. What is it that you want to propose? Do you want to change how school lunches are? What's in school lunches? Do you want to ban snack machines in all the schools in Pennsylvania? What is it that you want to see change? And we can't tackle the whole problem, but we can take one little bit of it at a time and impact it. Marijuana legalization. Marijuana is becoming legal in more and more states for both medical and recreational use, and we don't know what the ramifications of this is going to be yet. So I have a lot of graduate nursing students who are very concerned about that. Family and sexual violence. Breastfeeding advocacy. There's always a push for that as well. We know that it has many positive effects on babies. So why aren't we supporting moms who are breastfeeding? Supporting them in the workplace, giving them time to go pump, things of that nature. Human trafficking, which is more of a global issue. Nurses even are focused on environmental health, like clean air and tobacco use. Vaccine compliance, that's a very important issue as well. LGBTQI issues. It used to just be LGBT or GLBT, but now we're becoming more astute to complex gender issues that individuals have, gender assignment surgery, those sorts of things. So that's a whole area that's opening up as well. And it seems like I often have a graduate class with someone who is gay or who is a lesbian, and they're very concerned about not being able to voice their health care concerns when they see their providers for fear of being judged. So, of course, there's many other issues too. I just had a student who's in the military, and she was concerned about sexual reassignment surgery, hormonal replacement, and educating, I was going to say GIs, people are going out in the field on how that's going to affect them, while they're out in the field fighting. So very interesting, something I've never thought of, but we all come from different backgrounds. Even things like bicycle helmet safety, concussion management, our own concerns that affect advanced practice registered nurses, like independent practice and reimbursement issues. Excuse me, not only for NPs, but for nurse anesthetists, midwives' concerns. And I am not a nurse practitioner, by the way. I'm a nurse educator with my PhD, so my background's a little bit different. That's why I teach you courses on health policy, nursing research, and just the advanced nursing role and transitioning to it, advanced pathophysiology, those kinds of support courses, because I am not an advanced clinical person. When I work as a nurse, on a registered nurse working on the unit. So, and certainly many of us are very concerned about the Affordable Care Act disappearing and people not being able to get health care. And quite frankly, that's something that I really feel strong about. In the ER, I see a lot of children come through who are very, very ill, and they may have their mouth swollen up to hear from a dental problem, and they don't have an appointment with a dentist for another month. and they don't have the money to go anywhere. And it's hard for them to get to Pittsburgh, where they're the only dentist that will see them and take their government subsidized cards for health care in Pittsburgh. So it's really sad. I mean, some of these people don't even have a family car. So those are all concerns. So you'll be asked to select the health concern in this course to work with. So think about what you feel passionate about and try to move beyond the organizational policy mindset to healthcare policy. So best wishes for your success in NURS 645. Good luck to you. And remember, if you need to get in touch with me, you can reach me at cstiller, Stiller, at clarion.edu. And that really is the quickest and fastest way. But I also have my cell phone in the syllabus, and you can call me during my office hours. Or if you're in some kind of panic or crisis, you can call me at other times as well. Just please introduce yourself. Tell me which course you're in. Hi, I'm Kate Stiller in NURS 645 at Clarion. Here's my problem. I have to have emergency surgery, and I'll be out of class let's hope that doesn't happen. That happened to me last semester, so I don't want that to happen to you. But please just ask for help. And if you need an extension for an assignment, please ask ahead. And I'm sure if you're asking for an extension, it's something that merits that. So remember to speak up. All right. Well, best wishes to all of you, and thank you for listening today. And I hope to create additional lectures that will help clarify some of the more difficult content in this course. Thank you.